Dr. Ray here, and I am going to be talking to all of you who have had a gum transplant of any type. Now, also included on our website are basic postoperative instructions. Every one of those instructions apply to you as well. But there are some very specific things that also apply to you that do not apply to other procedures that we do. And we're going to talk about those in this little video. So if you've had a gum transplant, there will be a bunch of little tiny sutures used to stabilize that transplant. I really make an effort to suture your gum transplant very, very thoroughly. So do not worry that your gum transplant is falling off. Oftentimes, there is a surgical wound dressing over your transplant, which you will lose during healing, and that is what is coming off, all right? Now, the gum transplant site may ooze a little the first day. That's completely normal. Now, one of the reasons I put that dressing over the top of your gum transplant site is to prevent this from happening, because it's very difficult for you to apply pressure over the actual site where the graft went. But conversely, it's very common to have oozing from the donor site, from the palate. And if you have oozing from the palate, you will have been given some little gauze pads. You take one only of those gauze pads, you run it underwater, you wring it out, and you remove your little wound protector. That's the little plastic retainer thing that you have in the top of your mouth. And where the bleeding is coming from, you apply direct pressure using that wet gauze. You watch the clock for 15 minutes, holding pressure the entire time. Then you remove the gauze, your thumb, put your wound protector back in. You sit on the sofa or the bed for an hour with very little activity. And I guarantee you, 99% of the time, you will control your bleeding doing that. So do not freak out. Do not stuff your mouth with a bunch of Kleenex or a towel or a wash rag. You must be using something small like the gauze we gave you and using that direct pressure. Now, what do you do if that doesn't work? Well, also in your post-op care kit, you will have a Lipton's iced tea bag. You take that Lipton iced tea bag, you run it under the water to dampen it, you wring it out, and you do the very same thing. Direct pressure over the site bleeding. The interesting thing about tea leaves is that they have something called tannin, and tannin will cause blood to clot. That is why we give you a tea bag. Now, you can also drink the tea if you like, but the tea bag is actually meant to be used for control of bleeding postoperatively. Any black tea will work. The less caffeine and dark the tea is, the less tannin there is. So if for some reason you cannot find our tea bag, don't try to put a chamomile tea bag in there. It's not going to work. You really need that dark black tea, okay? But that's very, very effective. Anytime a patient's come to my office with uncontrolled bleeding, 9 times out of 10, we control it with pressure and nothing else. There are exceptions to that rule, and primarily those patients are taking blood thinners. So if you are having bleeding and you're on a blood thinner, you need to give me a call. The wound protector is that little retainer, and I mentioned that just a minute ago. And the wound protector should be left in place without being disturbed at all the first 24 hours if possible. And then the morning after your procedure, you get up and you take that little guy out. Do not be surprised if something falls out with it. That's going to be that wound dressing that I talked about. Otherwise, once you take the wound protector out, leave your palate alone. You don't brush it, you don't clean it, you do nothing. You can rinse your mouth, but that is it. You need to take that wound protector and brush it and clean it. Rinse it under cool water, and then most likely you will have been given something called AO gel. This is a small bottle in a pump, and you pump a little bit of that AO gel into the top of your retainer and then replace the retainer into the mouth. If you're unclear about this, give us a call. The AO gel is purely meant to keep the area comfortable. It is a soothing gel. That's all it does. If for some reason you don't have it, you're gonna heal fine, but it's just a soothing gel, and we generally dispense it with this procedure, okay? And then smoking. If you want to see your procedure fail, then just go ahead and smoke. Smoking is the #1 risk factor to complication with a transplant procedure. So don't do it. It's a bad idea. And then ice. Again, I cannot emphasize enough that ice packs and packing the area with ice the first 24 hours is going to do the most to prevent swelling for you over the course of your treatment healing. So do please use ice. And then lastly, if you have any questions, give me a call, 210-269-6498. Happy healing.